All right, we'll be moving now from Kenya to Zimbabwe. The death toll from a measles outbreak in Zimbabwe has risen to almost 700 children. The Ministry of Health and Childcare announced that 698 children had died from the measles outbreak since it started in April. The latest figures are more than 4 times the number of deaths announced about 2 weeks ago, when the ministry said 157 children, most of whom were unvaccinated due to families' religious beliefs, had succumbed to the disease.
And is engaging traditional and faith leaders to support the drive. Now, joining us to shed more light on this issue is the World Health Organization Head of Office in Zimbabwe, Dr. Alex Gasasira. Good morning, Dr. Gasasira. Thanks for joining us. All right, we seem to have your device on mute. Can you help unmute your device so we can hear you clearly?
All right. Can you hear me now?
Yes, now we can perfectly. Thanks for joining us. Can you help explain, how measles spreads and the possible prevention measures that, we must take?
So measles is one of the most contagious diseases known by human beings. It spreads by droplet infection when a child coughs, sneezes, and is close to another child. The virus spreads in that way. And the most effective way of preventing measles is by vaccination. We have a very safe, effective vaccine that has been around for many years. And with the use of vaccination, measles can actually be, eliminated.
So let's talk about what's currently happening. Our reports have it that on the 1st of September, 37 children died in a day, and that as we stand, we have 698 children that have died as a result of this current outbreak, which is the worst since the past 11 years. Talk to us about some of the inhibitions, or what are some of the concerns concerning the reasons why people are not taking the vaccines. We have religious reasons. Why are they not taking these vaccines?
Thank you very much. So there are two reasons that have resulted in many children in Zimbabwe not being vaccinated. One is the reason that you have pointed out. Some communities are hesitant to receive the vaccine for different reasons, but we must also remember that over the last 2 years, during the COVID pandemic, the vaccination services across the country, as was the case in other countries across the world, were interrupted because of the COVID-19 restrictions, diversion of resources to address COVID-19. So it's a combination of those two factors, services not being as widely available as they should have been in normal circumstances, and the pockets of communities that have not been comfortable to present their children for vaccination. So the government of Zimbabwe, with the support of the World Health Organization and other partners, are trying to address these factors. As we speak, there is a vaccination campaign going on across the country. Communities are being, informed, educated, and concerns that they may have about, the safety of the vaccine are being addressed through education and information.
Well, now you're talking about vaccination. Let's, also ask, about your views on it. You're on record saying that vaccinated children beyond 5 years should get revaccinated. Would you explain why?
So thank you very much. So indeed, we hope in any normal circumstances that all children should have been vaccinated, before 2 years of age. During the first year of age, at the age of 9 months, children should receive their first vaccine, measles vaccine. And during their second year of life, they should receive their second dose of measles vaccine. But this does not always happen to be the case. Many children, for one reason or another, may miss out on vaccination at the recommended age. And when they miss out on their vaccines at the recommended age, they remain susceptible to the disease in an outbreak situation such as we are experiencing in Zimbabwe at this time. So during an outbreak setting, the World Health Organization recommends that all children should be vaccinated, irrespective of their previous vaccination status. In that way, we ensure that those who have never been vaccinated are reached and vaccinated. Those who may have been vaccinated before can be vaccinated again, because this just boosts their immune, response and double protects them against, the infection. And in this case, we reduce the number of children who may be susceptible to severe illness and death.
Some are calling for the enactment of legislation to make vaccination mandatory, knowing that education seems not to be working in this time. Education alone seems not to be working. Could it be the possible best way to deal with the theories against vaccine, and is this ethically acceptable?
So indeed, there are situations where mandatory legislation has a role to play, but that should not replace efforts to dialogue with communities, to build trust, to address their concerns. Because once we have consensus and once we have communities that understand the importance of vaccination and understand that this is best for their children, that is the most sustainable approach. So that would be our primary, effort. But we do understand that governments may opt to take the route of mandatory legislation to complement. So the two have their role to play, but I really would like to emphasize the very important role of getting communities to understand and trust and participate in vaccination activities.
Now, what we've seen as well is a reduction in the statistics of people that are open to vaccine. 2020, we had 95%. 85%, which usually, before 2020 was 95%. Would you say that the fears concerning COVID-19 as well may have in some way impacted people's ability or susceptibility to being vaccinated, I beg your pardon?
Yeah, well, that could very well be a reason. And it's really also a responsibility on us as health workers, as service providers, to understand people's reluctance, to understand their concerns. Because once we understand these better, we are in a better position to give them information to make them comfortable that what we're offering to them is safe, is for their benefits, and it's good for them and their communities. So that is part of the work that's ongoing to better understand whether the recent introduction of the COVID-19 vaccination may also be amplifying some of the vaccine hesitancy that we are seeing.
All right. Well, there's a lot of work that needs to be done. Can you share a time frame, that you believe would work if, these steps are taken to completely rid, the country of measles?
So as you very accurately described in your introduction, this outbreak is claiming lives. It's claiming lives of children. So we are working, the government and we, the partners supporting the government of Zimbabwe, are working, urgently to get to all those communities to allay their concerns so that children can be protected and this outbreak brought under control within the shortest time possible. So this is being treated as a public health emergency, and we are all doing everything we can to bring it under control within the shortest time possible.
All right, thank you very much for joining us this morning. We do hope that you're able to adequately deal with this and that the measles does not claim further lives of our children.